I'm Mr. Rohan Bidaye. I'm one of the ENT consultants and a voice specialist working at University Hospitals of Northamptonshire. Majority of the patients which come to my clinic have some sort of voice problems. The commonest pathology is something called as vocal cord paralysis. What that means is the nerve supplying the voice box is paralyzed because either due to a surgery or a tumor pressing on the nerve. These patients present usually with hoarseness of voice, a change in voice, and also have some swallowing issues, especially choking episodes while they're eating and drinking. Hoarseness does affect their work and also their social life because their identity is taken away. But if they do present with choking episodes, that can lead to aspiration and chest infections, which can be life threatening. So most of the patients who present to me are within the first few days or few months of their paralysis. What I offer them is a temporary solution for their condition. Say, just consider this to be the voice box or the larynx, and one of the vocal cords is not working for these patients. So I offer them a temporary filler injection into the vocal cord to plump it up, close the gap, and they can use their voice a bit better. Along with this, you are referred to our speech language therapy team for some voice therapy exercises to strengthen the rest of the muscles. This usually works fine for a few months, but unfortunately, if it's a permanent paralysis, they do present back to me with their voice problems, and then I offer them permanent options. We've been doing these surgeries for many decades, but traditionally we've been using implants which have been static. By that, what I mean is we create a window over here at the side of the voice box, and we push a implant in, like a Silastic block or a Gore-Tex tape, which sits in that area and pushes the voice box in or the vocal cord in to give us a good voice. But unfortunately, because these implants can't be manipulated after the surgery, some of the patients, in fact, 1/3 of the patients, do not have an optimum voice after the procedure. Now, to tackle this issue, the A-Prevent company came out with this new implant, which is basically a titanium implant with a elastic balloon at the end of it. This is the A-Prevent voice implant. As you can see, there's a titanium casing which covers this elastic balloon. How the balloon works is through the port, we inject saline and we are able to inflate the balloon. Based on the patient's needs, we can inflate or deflate the balloon to get an optimum voice. This can be done during the surgery or even after the surgery in the outpatient's clinic. This is how the implant fits into the voice box. What we start off with is carving out this window in the cartilage. This is usually done with a drill or a knife, and the measurements here, especially this bottom bit, which is just a few millimeters, is very important. Once the window is carved out, we have to push the implant in such that it fits and snaps into position. Once the implant snaps in, there is a plate which needs to be screwed in onto the cartilage. After this fixation, the implant looks something like this on the inside. If I inject this implant with saline, you can see the balloon inflating there and pushing the vocal cord in. So I saw this implant advert actually last year at a conference. It caught my eye. I took it through our usual clinical governance approval over here in the department. The team was very happy for me to trial this. We did our first case in June 2024. We usually have the implant founder, the consultant surgeon from Austria, who flies in specifically for these surgeries. It's quite a precise measurement in millimeters, which is required on the voice box. So he supervises me as far as the measurements are concerned, because that can be the difference between success and a failure of this procedure. The surgery can be performed under general anesthesia or local anesthesia based on the patient's preference. Under local, the advantage is as I inflate the balloon, I can actually listen to the patient's voice, and we can optimize their voice precisely to give them the best outcome. Let's check your voice now, John. Can you give me a E? Beautiful. Voice is not just sound, it involves how we express ourselves, and it also forms a very important part of your identity. Patients who present to me with voice problems often suffer with an identity loss. Um, Fortunately, with treatments like the voice thyroplasty, we are able to not just restore their voice back, but after all, the confidence and the quality of life is also improved significantly. Most of the patients have been very, very grateful and really thankful for the voice outcomes after. But yes, one patient I do remember very fondly. He unfortunately came after a complicated surgery that he had a voice problem. I did the implant procedure and he woke up like a different man. We've been working as a collaboration in ENT over the last few years. At Kettering General Hospital, we specialize in laser surgeries and temporary fillers, whereas at Northampton General Hospital is where I do the implant procedure. So the patients benefit from having access to both these treatments across both sites within the county. Thus, we can offer comprehensive state-of-the-art care for all their voice problems and laryngology needs. Since last year, we've done approximately 10 procedures by now, and we are hoping to do around 15 or 20 procedures this year. The results have been very promising, and we are soon to publish them. In fact, we were the first center outside of London to adopt this procedure, and we are in the top 3 centers across the UK doing this procedure. So, yeah, exciting times ahead.